Hello, I'm Dr. Peter Hosen, glaucoma specialist and board-certified ophthalmologist. Glaucoma is a disease of the optic nerve. Today I'll be talking about open-angle glaucoma. Typically, the problem with glaucoma is that it's asymptomatic, in that there's no pain, and typically vision loss is towards the end of the disease. So it's commonly known as the sneak thief of sight, as glaucoma first affects the peripheral vision and over decades tunnels in and eventually affects all vision. So it's incumbent upon your eye doctor to do a thorough diagnostic workup to ensure that you do not have glaucoma. How is the diagnosis made? First, we check the eye pressure. Second, through a careful dilated exam, we examine the optic nerve. Finally, we take a thorough history, making sure there is no family history of glaucoma or history of trauma or surgery to your eye. Lastly, we take a thorough medication history to make sure there are no medications that can possibly raise the eye pressure or put you at risk for glaucoma. If either the eye pressure is high or the optic nerve looks suspicious for possible glaucoma, additional diagnostic tests are ordered. Typically, we perform a visual field test, which is an automated test of the peripheral vision. Second, we perform a high-resolution scan of the optic nerve. Lastly, we measure the thickness of the cornea. The cornea is the eye window. During the eye pressure check, we briefly touch the cornea to check the pressure. However, if the cornea is either thick or thin, it can falsely throw off the measurement of the pressure. If the diagnosis of glaucoma is made, we then initiate treatment. It is important to understand that there is no cure for glaucoma. Once again, glaucoma is nerve damage, so if there is nerve damage, we cannot reverse it. The goal of therapy is to prevent the glaucoma from getting worse. Typically, we use eye drops to lower the eye pressure to prevent additional damage. There are a variety of eye drops. Initially, we start with one drop that's fairly easy to take in the evening hours. If that is inadequate in controlling the pressure, then additional eye drops will be necessary. Another option for treatment is laser. If either the drops or the laser are insufficient in controlling the pressure, or if there are side effects from the drops which make them too intolerant for you to tolerate, then we talk about performing different surgeries to lower the eye pressure. I hope you found this information about glaucoma useful. As a reminder, glaucoma is a potentially blinding disease. However, in the 21st century, with our advanced diagnostic and therapeutic techniques, it is highly unlikely that blindness will be in your future. I look forward to taking care of you and your eye to ensure that you have vision for the rest of your life. Thank you for your attention.